intro.
Download your favourite apps with Huawei Petal Search. Download now.
In a moment, I'll hand over to the Director General to provide today's update. I imagine that there'll be quite a few questions. After the Director General and I have been through our introductory remarks, we'll then take questions. We'll then hand over to Dr. Woods and Air Commodore Webb, who will be able to answer any questions regarding managed isolation and quarantine facilities. So, Director General, I'll hand over to you.
Thank you, Minister. Kia ora koutou katoa. So there are 13 new confirmed cases of COVID-19 to report in the community today, and there are no new cases of people returned from overseas in managed isolation facilities. 12 of the 13 new cases are linked to the previous cases in the community cluster, and one remains under investigation but is believed to be linked to the same cluster. There are 98 people linked to the cluster who have been moved into the Auckland quarantine facility. That includes 44 people who have tested positive, and the balance are household contacts. There are 6 people receiving hospital level care for COVID-19. 2 are in Auckland City Hospital, while 4 are in Middlemore. None are requiring intensive care. The 13 new confirmed cases today to report bring our total number of confirmed cases of COVID-19 to 1,293. One previously reported probable case is now reclassified as under investigation. The total number of active cases in New Zealand is currently 90, of which 69 are from the recent community outbreak. There is one further community case, more on that shortly, and there are 20 imported cases in quarantine facility. So, genomic sequencing. Genomic sequencing has provided more information about 2 cases of COVID-19 that were under investigation. We have been able to genomically link the household of 5 positive cases, of which that's one of the 2, and household contacts. One of those is the person currently in Auckland Hospital, and they have all now been linked to the existing cluster. That is through the genomic sequencing. It still remains for us to identify exactly how the household is epidemiologically linked, but we now know that the virus found in the cluster is essentially the same one that is found in the members of this household who have tested positive. This gives us a high level of reassurance that these people are part of the same community cluster rather than it being a separate cluster. Now, the second case is a man who is a maintenance worker at the Ridges Hotel, which is one of our managed isolation facilities in Auckland. The man carries out maintenance tasks on the rooms there between bookings. That is following full infection prevention and control and disinfection of the rooms, and while wearing appropriate PPE. He tested positive his positive test returned on the 16th of August. And the genome sequencing indicates his case is not linked to the current outbreak in the community, but is most closely linked to a positive case that was in the Ridges and was identified on the 31st of July. This is a returnee from the USA. Now, there is some further genome sequencing and matching being completed on this case today, and you will have seen there is further information in a media release that went out recently. On contact tracing, since the 11th of August, 1,880 close contacts have been identified, and 1,691 of those have been contacted and are self-isolating and have either been tested or are waiting for testing as appropriate, and other contacts are in the process of being contacted. As I outlined yesterday, a number of locations can become of interest as we go through our investigations. And in most cases, people who were at those locations are considered casual contacts and are at very low risk of any infection. Anyone who is a close contact will go into our National Contact Tracing Service and be contacted. Casual contacts only need to call their GP or healthline if they become well, or to get advice about getting a test if they are concerned. All these places have just had a visit by someone who it transpires is a case. It doesn't mean that there is a need to avoid those places. these places are all notified and undertake appropriate cleaning with guidance from our public health teams. We've also been using the NZ COVID Tracer app to notify people who may have been in these locations. There are two more locations of interest I just want to mention today. One is the Pack and Save supermarket in Apirana Avenue in Glen Innes, Auckland. The confirmed case visited the supermarket there a number of times between the 31st of July, initially at 10:09am, and then between the 8th of August at 10:10am, so several times over that period. At times the case was up there for an hour doing shopping. The other location is the Mount Roskill Primary School on Frost Road in Mount Roskill, and the confirmed case was at that location in the 24-hour period between 1:40pm on the 10th of August and 1:40pm on the 11th. And just a reminder, anyone who has visited those locations at those times does not need to do anything except be aware of symptoms and, of course, seek advice about getting a test if you become symptomatic. On the Americold environmental testing, a final report is expected to be completed imminently with input from MPI and our ESR staff, looking into that possible route of transmission through chilled services on materials arriving from overseas. The full report will have the detail, but it seems clear now that the possibility is being ruled out from that investigation. We'll have further details later in the week. An update on the exemptions process for people wanting to travel into Auckland. The Ministry of Health has received over 5,000 applications so far. 700 have been granted, 160 declined, and there is a team from right across government that is working as quickly as possible through those exemptions. They will be granted where there are circumstances like the need to access medical treatment, provide care for a vulnerable person, or to visit a dying relative. And there are some business exemptions that are also being granted where that relates to critical infrastructure or food supply chains. And finally, on the NZ COVID Tracer app, we now have just shy of 1.5 million users, and that's around 37% of the population aged 15 and over. Minister.
Thank you, Dr. Bloomfield. Record levels of testing continue across the country. Over the last 5 days, we have processed more than 100,000 tests. 18,421 of those tests were processed yesterday, and labs are working well within the 48-hour turnaround timetable that they have been set. And in fact, I'm told that most test results are still being completed within 24 hours. I do want to thank all those involved in the testing process. It is an enormous undertaking. Our lab workers in particular are working incredibly long hours to get these test results processed, and I want to thank them for their commitment. Testing has ramped up at the border, both at the airports and at the ports. Testing of all government agency frontline staff at the Auckland border, that's Customs, Biosecurity, Immigration, New Zealand Aviation Security and so on, will be completed very soon. To date, more than 3,485 workers at ports around New Zealand have been tested for COVID-19. At the Port of Auckland, more than 5,000 staff working from around 800 different organisations have accessed the port since the 21st of July. As at 6pm last night, 2,194 of those people had been tested. A dedicated testing team is operating extended hours to ensure that workers all have access to COVID-19 testing, including those who are working the night shift and the twilight shift. At the Port of Tauranga, a dedicated swabbing site was established by midday yesterday to begin testing around 6,000 potential workers at that site. I've been advised that by 9:30 this morning, 95 workers that were considered to be high priority had already been tested alongside others. Testing is also underway at the 8 other ports around New Zealand. As of 6pm last night, Auckland Airport, the testing station there had swabbed 2,407 of the 4,474 potential workers, with a testing team working through the night last night to capture night shift workers. With regard to testing in MIQ facilities, and again I note that Dr Woods and Air Commodore Webb are here to answer further questions on this later on, we have had 2,806 tests completed, that's 97% of the workforce in Auckland. So that's of Auckland, and across the rest of the country, 1,599 staff working in MIQ have been swabbed. Happy to take questions. We will be here for up until about past, and then we will hand over.
How likely is it
Tova, you can go first.
How likely is it that there's another cluster linked to this US strain?
Well, look, I'll get the Director General to comment on that, but at this point, all of the information we have suggests that this is contained, that this is just one person. Obviously, that investigation work is now underway. The immediate close contacts, so the household, and the work contacts that have been tested have all come back negative. So that is a very encouraging sign at this early stage. And obviously, you know, this is how we want the system to operate, which is that where there is an incursion, you identify it quickly and you stamp it out. If that is what happens with every case, then further alert level restrictions aren't necessary, because that's the way the system's designed to operate.
So those speak to a lack of testing, given this person presumably wasn't tested for 3 or 4 days after the onset of symptoms, and weren't quarantined for 6 days after the onset.
No, I'll ask the Director General to comment again, but this person was tested fairly early on after displaying symptoms, and there was testing at testing at the Ridges Hotel only a couple of weeks before this, the testing system has been, as we've already said, ramping up. This person was identified right at the appropriate time. But again, I'll ask the Director General to comment.
Minister. So a couple of comments. First, just to reiterate to your original question that none of the household or work close contacts, and indeed none of the staff at Ridges, who were all tested towards the end of last week as part of testing all our MIF workers, they've all been tested. None have returned positive tests other than this person. His test results suggest recent onset of the infection, and he was tested on the 13th. As soon as the test result came back positive, he was in self-isolation, close contacts identified, and so on. And there is a number of casual contacts from a church service, which is in the media release. 56 people all have been had contact made, except for 2 who they're just waiting for a callback and are in self-isolation and being tested as well. So this seems very, very well contained, and that's we'll keep you updated on that.
We'll let Tova finish, and then we'll come to Jess.
Sorry, are you sure that all of the staff at those managed self-isolation facilities have adequate protection, that their safety is kind of paramount? If you haven't been able to establish the person-to-person links yet, was this person given the proper PPE? How could this happen? Look,
Minister Woods, I think, is going to talk a bit more about what happens at the facility. What I would say is that this is someone who's is a maintenance worker who works for the hotel staff, so doesn't have interaction directly with any of the guests. So once again, a little bit of a mystery here, one that we will be investigating fully to find out. But I can say that when the maintenance workers enter any room, that someone positive might have been, and they do have appropriate PPE.
Saying that it's a mystery, though, good enough? I mean, shouldn't we know where this comes from? Does it talk to a system failure, that things weren't cleaned properly, that processes weren't in place?
I think we don't know yet.
Yeah, and can I just make a comment on that? You know, ultimately we're dealing with a virus here. I think what you'll hear from very shortly, in about 15 minutes, is that there are very extensive protective measures in place at MIQ facilities. Now, the investigation so far, you know, we go through everything, CCTV footage of all of the people concerned to identify where contact may have happened. It does show that this is a highly contagious virus that is easy to get, and you know, we're doing everything we can to put protective measures in place.
Should it be happening? Should it?
Well, what I can say is, you know, you can put very, very stringent protective measures in place. There is no such thing as a 100% guarantee, even if you have the very best protective measures in place.
What are the working theories on testing border workers? Why are there still exemptions for airline crew coming into the country?
Look, there are different arrangements for airline crew coming into the country. There are very strict arrangements around what they do when they're on the plane, what they do when they're off the plane if they're stopping in another country, to ensure that they're not coming into contact with COVID-19 if they're having a layover in another country. They have a 48-hour stand down when they return to New Zealand. They are tested at the end of that 48-hour period. So there are different arrangements in place for aircrew. There, of course, are a lot of protective measures taken for aircrew.
That's the testing that you mentioned, that's just in place for people coming from high-risk countries, right? So can you give us some examples of what's high risk, medium risk and low risk?
Now, all aircrew who are coming from overseas should be tested at the end of their 48-hour stand-down period. Now, one of the things that I'm going to be doing in the next few days to eliminate doubt, because we continue to get questions about this, by the end of the week I will issue another order that specifies all of this so that there is absolute clarity around it. But the rules are very clear to those who are following them at the moment, but to avoid any public confusion about that, I will issue another order that makes that very clear. I'll let you finish that.
Why are crew working on transfer flights, taking people between managed isolation facilities or from Auckland to managed isolation facilities, why are they still not required to be tested or isolate?
Look, I'll have to come back to you on that one. I'll come back to you on that. Yeah.
Can you clarify, Dr. Bloomfield, was the man, was he tested on August 13th? Is that what you said?
Yes, he was tested on August the 13th.
Was he tested because he was symptomatic or because there was an outbreak and there was mandatory testing in the border facilities?
Everybody at that facility was tested on the 13th. So that's part of the routine testing regime that we have been putting in place, which is he was picked up as part of the routine surveillance testing.
His symptoms onset 2 days before.
Yes, perhaps I could just talk to that, knowing the clinical picture. So he had some mild symptoms 2 days before that he attributed to a pre-existing condition. They then went away, and so that's why he was back at work. He didn't actually have any symptoms when he was back at work.
A senior quarantine officer has told us that staff at the border had asked for a regular testing program weeks ago. This was declined. Unions also say their members didn't have an issue with tests. So why are you trying to shift blame and say that the border workers didn't want tests?
Look, I think we've been through this over the last few days. What you'll see from the numbers is that the rate of testing has been steadily increasing over the last 3 weeks or so. I've been very clear we would have liked to have seen those numbers increasing faster. What we also know, though, is that not everyone was being tested at work. So those who got tested through a community-based assessment centre, a CBAC, or who got tested at their GPs, we, up until now, have not necessarily been recording them in the right column to be able to say that they were, to categorise the nature of their work.
But you also said there'd been a reluctance among staff to be tested. So why did you say that when the border officials are saying that's absolutely not the case?
Look, there has been some reluctance among staff. That's certainly the advice that we have had. There certainly isn't now, which I think I said 3 or 4 days ago as well, which is a good sign.
But is that fair, though? Because it paints the picture that the workforce weren't keen when the reality is that it wasn't being offered to them.
Look, it was a variety of factors. I've never said that that's the only factor. There are a variety of factors. Hesitancy to be tested has been something that we've been grappling with a lot across the country up until now, including for staff who are in that category. It's not been the only one. As I've said, one of the line of sight issue around people who are being tested and making sure that was recorded in the right way has been a challenge as well. That has now been addressed. So there has been more testing taking place than people might necessarily think, but it hasn't necessarily been recorded and reported in the way that we're now doing to give that greater degree of transparency.
Are you also aware that another one of the factors is that people have been volunteering themselves for tests and have been declined those tests?
They should not have been declined tests.
Are you aware that was happening? Minister, are you aware that was happening? Because that's what we're hearing anecdotally.
Yeah, look, beyond anecdotes, so I get anecdotal reports all the time, and I can tell you every one of those anecdotal reports, and I'm sure Dr. Bloomfield can tell you every one of those anecdotal reports I've been following up with the ministry. And obviously, we've been working very hard to get testing happening in higher volumes and more frequently.
Dr. Bloomfield, just on the maintenance worker, you say it's a mystery how they contracted the virus. What are the different theories you're investigating? And just to be clear, this worker never entered the room of the returnee.
So I think it's best in that regard to Minister Woods will talk to that shortly. I think there are a couple of possibilities: human to human transmission directly, And it may well be, and that's part of the reason why all the guests and the staff are being retested, is whether there was someone who was an intermediary between the guest who tested positive on the 31st and then this man who has tested positive. So that's one possibility. And the other is through environmental contamination, because we know this virus can survive on surfaces, not for that long, but it can survive and infect people.
All right,
we'll come back over here.
Minister, on the exemptions for aircrew, on the Ministry of Health website, it says on return for aircrew coming back from low and medium risk countries, they just complete a health assessment and then can return home and operate as usual.
I'll just get the Director General to answer that.
I don't have the technical detail on that, but we can come back to you on that.
We will.
Could you just further detail the health act order that you're going to bring in around testing later in the week?
Yes, so we'll there'll be 2 orders that I will be issuing, that I'm endeavouring to issue by the end of the week. One is an order that clarifies exactly, well, there may be one in the same order, but two distinct issues. One will be around formalising the regime for aircrew, because while there is a regime in place, there's still a lot of questions about it. So formalising that in an order will make it much more transparent to people. And the second will be formalising the routine testing that will go forward from here. The order that I have put in place this week, or the 2 orders that I've put in place this week, are around this surge of testing, and then of course the next order will make sure that we're maintaining our testing, our surveillance testing, and it will specify exactly what's expected there. So I'll let you follow that one.
What will you specify? Weekly testing?
That is exactly what we're working through at the moment. So it'll be based on a risk-based framework. So those at the higher risk will be the most frequently tested. So we'll come back over here.
The order that was forthcoming on the contact tracing requirements for businesses at level 2. Apparently there's some redundancy in the existing order that your office was seeking to handle. When can we expect to see that?
Yeah, that will be updated this week as well. So as you'll be aware, the latest order puts in place a mandatory requirement for QR codes to be displayed. There is still a bit of an ambiguity about whether or not people need to be making people sign a manual register and scan in using a QR code. So we'll make it absolutely clear that it's an either or, that you need to make sure that there's a system for recording everybody that's entering, but it does not have to be both. And so we'll clarify that in the next order that we're putting out. So let me just finish that.
Dr. Bloomfield, how many of the now 70 cases in the community have had their genome sequenced or will have it? Is the plan to sequence all of them?
Yes, so all new cases we are getting the genome sequenced, and any case in managed isolation now will be sequenced. A number of earlier cases have been sequenced, but by doing them at the time, we know there's more likely to be a successful genome sequencing done because there'll be RNA material in the sample. So yes, all the new cases are being sequenced, and furthermore, that will help us sort of outline, the ESR will outline the sort of the relationship between the cases, so it gives us a clue about who was infected first and who they then infected, because each time the virus is passed on, most times there is a very small change in the genetic makeup of the virus, and so they can map through what the chain of infection is. At this point, I can say that it seems so far that the case that was the first is the person from the Americold facility whose symptom onset was the 31st of July. So the genomic testing to date suggests that person was the first to be infected in this cluster.
Okay, we'll come back over here.
Can I just check in on the numbers of the Auckland cluster? Another 13 today. It doesn't appear to be dissipating. Is it on track to becoming the biggest cluster through the pandemic? And should Aucklanders start that mental preparedness that they might be spending more time in lockdown?
Look, I think in the last part of your question, that's all very premature at this point, in terms of speculating about what may happen. We've always been very clear that we keep a constant watch on these things. We're constantly reviewing the alert levels, and I'm not going to preempt any decisions about that. I think that's still far too early. In terms of the number as to whether it ends up being the biggest, I'll hand over to the Director General.
Look, I think you're right. It is on track to being the biggest. One of the things that is different now compared with the clusters when we had the outbreak earlier and when alert level 4 and 3 is, we are increasingly confident we are tracing and identifying all of the cases, and because we've got all those close contacts in isolation and are testing them, we will have a better idea of all, and this is what we want to have, of all the cases associated with the cluster. whereas it would have been in our earlier clusters earlier in the year, there would have been other cases that were not identified, but because of the lockdown arrangements, there was no further community onward transmission.
But can I make one further comment on that, though? Because of the lockdown that we have, the level 3 lockdown we have at the moment, as we identify new contacts, they are effectively already in isolation because of the level 3 requirements. And so that has helped to contain the virus while we've been going through the contact tracing process.
The person who started the conspiracy theory that you referred to over the weekend appears to have been found. What is the appropriate action to take against them?
Look, that's a matter for the appropriate authorities. I don't have all of those details. I've seen that there's a transcript of a conversation with that person being released. I haven't had a chance to look at that or to read that. Obviously, there's some remorse on their part. That's an encouraging sign.
So research out today shows a lot of New Zealanders drink heavily at home. How worried are you about that worsening during lockdown? And will the government look at policy to tackle the issue of takeaway alcohol?
Look, I'd encourage all New Zealanders to drink responsibly when they're at home.
May I ask for an update on the exemptions? When you leave or go into Auckland, some people are given those exemptions. Why are they taking so long to come through? And why can't people who had exemptions in the previous lockdown just have those carried over and use those?
Obviously, it's a different situation in this lockdown in the sense that different geographical areas of the country are being treated differently. And so movement from a level 3 to a level 2 area, if you had free movement during that time, during the previous lockdown, it doesn't necessarily mean you should have free movement during this one, because that previous exemption you had assumed that the place you were going was under the same protective measures as the place that you had been, and that is certainly not the case at the moment. So it is a different process. I acknowledge that 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 will add a little bit of time.
We're getting reports that it's sort of up to 7 days. Is that appropriate given the circumstances we're operating in at the moment? Have you had reports that it's been too slow?
Look, everyone's working as quickly as they can to make sure that this is dealt with in as timely a manner as possible.
Yes. You were talking about that 48-hour turnaround type of testing, but we've talked to someone in managed isolation who have been waiting 4 days for their final test. What's the reasoning behind that, and is there anything that's been done to accelerate it?
That's news to me. We'll have a look at that. But
We'll have a look. The managed isolation tests, particularly those ones that are where people have to return a negative test before they go, we try to prioritise those. Of course, the Auckland labs have been processing high volumes, but we'll work with the managed isolation facilities to make sure those tests do get prioritised.
So on close contacts, is anything being done for second tests? Are they necessary, and are they being encouraged to go for those?
Can I just comment on that? So people are tested, but close contacts also remain in self-isolation for the full 14 days as well. No, not routinely, unless, of course, because they're on symptom watch also for that period. If they develop symptoms, then they are tested again.
All right, I'm just aware that we've only got a little bit of time before question time, and I do want to allow Dr Woods and Commodore Webb the opportunity to take the podium. So we'll take a couple more questions, and we will be back tomorrow, so there'll be plenty more time to ask questions tomorrow.
Minister, has any further thought been given to setting up an inquiry or review into New Zealand's response to the pandemic?
Look, I think it's inevitable that we will get to the point where that is sensible, but at the moment all of our focus is on the response, and I don't want to take people off the response to do too much reflective thinking when actually we need all eyes focused forward on making sure that we're dealing with what's in front of us right now.
So we understand that border workers have been leaving the international airport without tests to work in other areas of the country. Is that a problem?
Sorry, can you run that past me? I didn't quite hear that.
We understand border workers have been leaving the international airport in Auckland without tests to work in other parts of the country. Is that a problem?
Look, again, I can look into that, but I can tell you that everybody in the borders is currently going through a testing cycle, and that will be routine.
Follow on that, do you think it's smart or safe to have international air crews to have layovers at hotels in Auckland used by the general public?
The protocols that have been put in place with those hotels keep those air crew well separate from any members of the public. Very last question here.
Dr. Bloomfield, kind of following up on Ben's question, over the last couple of days there's been these dozens of new cases, and has there been any clarity from speaking to these people when they were infected? And I guess what I'm asking is, has anyone been infected since Auckland went into level 3?
Yes, within households. And the diagram we are updating daily on our website includes for each case their date of their positive test, and also, where pertinent, if they are symptomatic, the date of their symptom onset. So that creates a picture of how all these things fit together. And secondly, of course, as I talked about, the genomic sequencing helps us develop a picture of how the infection progressed through the community. But as I've said, and we found earlier in the year, most of those infections will occur within households, even when they go into quarantine, because they may well have been infected before that happened.
All right.
A quick education question, if I can.
Very last question to Tova. That's a bit cheeky, but go on then.
Thank you for a colleague. How soon this week could we see year 12 and 13 return to school, and are you confident schools can manage this safely?
So it's not automatic that year 12 to 13 students can go back to school. This is a process that they will have to apply for. They will have to demonstrate that they can meet all of the restrictions that are in place for people who are at work under Alert Level 3. So they'll be treated the same as every other workplace, providing they can demonstrate that, and they have to demonstrate that before their students would be allowed to return. They have to demonstrate that to the Secretary for Education, then they would be allowed to do that. I would envisage that the schools that will be using that, they'll be using that sparingly for those students who need to be on site. So there are some applied subjects which you can't easily do from home. And so that's the group of students that we're wanting to make provision for, bearing in mind that for those who are in potentially their last year of schooling, they've effectively lost a term out of a 4-term year. So we're trying to be as accommodating as we can, whilst not doing anything that treats young students and schools differently to any other workplace. And so that's the key criteria there. Now, Dr. Bloomfield and I will be back tomorrow, so we'll now hand over to Dr. Woods and Air Commodore Webb. Thank you.
Thank you. Well, as you've just heard from the Health Minister and the Director General of Health, there is a case of a worker at a managed isolation facility contracting COVID-19. Just want to give you a quick rundown and update, and obviously take any questions around that. As soon as we had notice of the positive result, a number of planned procedures were activated. The case of the maintenance worker is not linked to any incident, system breakdown, or indeed any wider outbreak at the facility. In fact, the facility is one which has had no serious incidents reported or indeed happen at them. As described by the Director General, there is a genomic link between the maintenance worker's case and a positive case of a US returnee who was in the hotel between the 28th of July and the 31st of July. The room the US returnee was in has not been occupied since her transfer to the Jet Park quarantine facility on the 31st of July, and it is still empty. The room underwent hospital-grade cleaning with hydrogen peroxide vapour sanitiser using a bioqual machine on the 14th of August. To date, there is no obvious evidence of person-to-person contact between the worker and the returnee. In fact, this case highlights how tricky and insidious this virus can be. I'll just now hand over to Air Commodore Webb to outline some more details, and then we'll take your questions.
Thanks, Minister. As the Minister has outlined, we took immediate action to limit the risk presented by this situation. A person testing positive for COVID in a managed isolation facility is something we're prepared for and practice at responding to. We have strong protocols in place. Obviously, this is slightly different in that it was the first time that a staff member connected to a facility has tested positive. As Dr. Bloomfield mentioned, it is worth emphasising at this point that this particular case involves a Rydges Hotel maintenance worker who does not routinely interact with any of those returnees. As soon as the positive test was established, a series of actions were undertaken immediately at Rydges. The hotel was put into immediate lockdown on Sunday morning as soon as the positive test was returned. Thorough cleaning of shared areas of the hotel were carried out, as the Minister has outlined. Close contacts of the staff member identified, and they were put into self-isolation until tested. Close analysis of movements were undertaken, and this includes a review of CCTV. We've also reviewed room entry data to look for connection to cases with other guests. Genomic sequencing has been sought through ESR. Health advice is sought on subsequent actions, and further testing of all returnees and other cases and staff were undertaken. Confirmation that infection prevention control measures were correct has also been followed. Once we had confidence and health advice that it was appropriate to do so, normal procedures within that facility were then resumed. Minister.
Thank you. We'll take your questions, Jess.
You talk about strong protocols, but how can you say that when obviously there was an error if they were able to have that person-to-person contact and infect each other?
No, I'll just start off and then I'll ask you, Commodore Webb, to comment more broadly on that. There is, at this date, no evidence that it is person-to-person contact. We're obviously still investigating how that may have occurred, and that will also include looking whether there's a possibility of surface contamination. It's something that we can't rule out and something we will investigate. In terms of our confidence level, in terms of the procedures that were required by the staff at this facility, it was an incredibly well-run facility. There have been no incidents at this facility, and in terms of the reports that we've been receiving back on a daily basis from the NZDF team that have been the operational leads at there, all the reports that we have been receiving is that this is a very well-run facility. But I'll ask you, Commodore Webb, just to give a bit more up.
On one other point, so the fact that it is could be surface-to-surface contact, doesn't that point to it being a system failure even more, that it obviously wasn't cleaned, it wasn't protected so that people were able to contaminate each other?
Well, what we do know is that the maintenance worker was not in the room of the US returnee after it was vacated on the 31st of July. In fact, no one in the hotel entered the room until the 14th of July when it was entered to be cleaned. We have verified that by using the room entry data, the card swipe access to the room in question. It's something that we've interrogated quite closely. So in terms of that being a problem, we have ruled that out through those processes. We have also obviously there's been interviews, as Air Commodore Webb said, with the maintenance worker and interviews with the returnee, trying to establish if there is any link, if they were in any common area. We are not seeing any glaringly obvious points of connection. This does not mean that we don't continue to keep investigating, but in terms of procedures around use of PPE by the maintenance worker and coupled with the knowledge of when he was in that particular room is something that we're satisfied with. What we have also done through looking through swipe card access is seen the times in which the US returnee was out of the room. She was a particularly a returnee who stayed in her room a lot for the 3 days that she was in the facility. I think 2 or 3 occasions when she left. So we are looking at CCTV footage at the periods of time when we know that she was out of her room to establish or not there was any contact. But really want to emphasise that a maintenance worker is not someone who has routine contact with returnees. They enter unoccupied rooms. Sorry, Jenna.
Do you accept that you have failed in your duty to actually test the MIQ facilities? It was supposed to be happening from June 23rd.
Look, I think you heard quite a deal of discussion about testing, obviously with the Minister of Health and with the Director General, and it's something that we've been working with Health over a period of time, particularly around surveillance testing and testing of non-symptomatic staff. That asymptomatic testing is something that we've been feeding through and something that is being rolled out. We're seeing now that we do have that mandatory regime in place. And
you would have been getting daily numbers of the tests coming out of those facilities, wouldn't you?
returnees, the daily reporting.
No,
the daily reporting we were getting were around returnees. I want you to bear in mind, until Friday, there was not a mandatory testing regime for staff, which meant it was incredibly difficult to monitor and collect that data, is the advice we were getting from Health, because they weren't all happening on site. Some people were electing to go to a community testing station, or to go to a CBAC.
ensured that those workers were being tested,
The-
and then you didn't follow up and ask questions
No.
as to whether
Surveillance
that was
testing had started in terms of the asymptomatic staff. That had started. It was in under the voluntary regime towards the end of July, and actually they were on site at this particular facility where this case has been earlier in July. I think around 30% of staff, of 30 or 40%, 40% of staff at this hotel did have surveillance testing carried out prior to this outbreak. But I would like to point out that surveillance testing was not on site when this individual has returned the symptomatic test. He was picked up under the new mandatory system where all staff are and where that was on site. Sorry, Gina.
We were told that mandatory testing wasn't necessary because the voluntary testing was being done. So why was that not happening? Where has the miscommunication occurred? Why did you not know that they weren't being tested?
But what we've said consistently, and you would have heard us stand on this platform many times and say that we've been continuing to work with health to ensure that it's not just symptomatic staff that can be tested, to roll out the system that we now have rolled out and has been rolled out, that we are having routine testing for all staff, whether or not they are symptomatic or non-symptomatic, and is broader than surveillance testing. That is something that we've continued to work with health on, and something we will continue to work with health with, because as I have stood on this platform and said, it is something that we have heard from staff when we've visited facilities about access to testing, and it is a reason why it is something that we have been working with health on.
We seem to be universally outraged by this. I mean, what should they make by this total accountability gulf, should we say, between the Ministry of Health, between your ministry and between the Prime Minister?
Well, first of all, I reject the premise of your question. In terms of the accountability, what we had was a voluntary regime. So there was testing for all symptomatic staff. I think that's something that needs to be well understood. The question was around the testing for asymptomatic staff, because the clinical advice from health was that you did not need to be routinely testing. One of the pieces of information that we've fed through that in health have maintained, and rightly maintained, that the most important proactive way in which we maintain our facilities to be COVID-free is through the use of PPE, through good infection prevention controls that are inside the facilities, and making sure we have those procedures right. That testing is only ever a reactive mechanism. It is one tool in our toolbox. But in terms of the fact that we now have that in place as a mandatory system, what we can report to you now is the fact that at the facility where this has taken place, there is 100% of all staff have been tested, and across the network in Auckland, I think it's 97% of all staff within MIQ have been tested.
Minister, are you saying that the fault here is that the Ministry of Health was essentially withholding tests, that staff didn't have access to them, they weren't able to get the tests, and that's what the hold-up was?
No, what I'm saying is we were working with them, and what we saw was a system being rolled out from mid-July, I think it was, 21st of July, the first one on site at this particular facility. We did have the rollout of surveillance testing, which wasn't just for symptomatic staff. Obviously, before that, there was the issuing of vouchers for people to be able to go to other facilities to have tests. So this was a system that was being rolled out.
Isn't there a difference between surveillance testing and routine testing? And routine testing was said to have begun to occur from June 23.
So surveillance testing and routine testing, yes, there is a difference, but in order to have routine testing, what we found out is that it needed to be mandatory, and that is the order that was put in place on Friday. Jess.
In terms of timing, the hotel was locked down on Sunday. Why are the public only finding out about it today?
So, of course, the case was reported at the time that any other case was. We had to do some health wanted to do some further investigations in terms of the links of the case. So the case was reported yesterday as it would have been as with any other case. In terms of going into the details of the case, we were waiting on the genomic sequencing to be able to link it to the cluster or not. That only arrived with us this morning, and so that's why we're giving the further detail. But the case was reported in the same way. But from our perspective, from a facilities point of view, and Air Commodore Webb can speak to this, everything that needed to happen happened from Sunday morning onwards.
Yeah, that's right. So as soon as we understood that the positive test had been received, the hotel reacted immediately, and all returnees were isolated in their rooms. Normal follow-up measures were taken, which included making close contacts aware, and then also isolating the close contacts, immediately starting the testing, follow-up work, and then the contact tracing that follows with that.
Why the delay though? Why not let the public know yesterday that this process was happening rather than just... did you want to wait and see so that, why wait?
Well, I think what we've seen is actually getting the detail is actually quite important in the process of follow-up. So the genomic testing to link whether it's a cluster that we're already aware of is a really key part of the analysis. And so the normal 1 p.m. reporting yesterday was consistent with the information that we had, and then that follow-up genomic testing is taken through to, as the Minister said, through to this morning.
It's important that the public know, though, with things like the church gatherings and things like that, doesn't that help people come forward and stop this spread? People would have been looking at it yesterday saying, oh, no one's reporting it, no one's talking about it.
So just to be absolutely clear, that all the contact tracing has been taking place. Nothing has changed because we haven't given the in-depth details of this case. The contacts from the church group have already been contacted. Testing is underway, so there has been no delay in any of the processes that needed to take place because of that. And as I said, the Ministry of Health wanted to wait for the details of the genomic testing so we could establish or disestablish the link with the known cluster. That came through this morning, and that's why we're in the position to be able to give you these details today. But in terms of the processes and procedures that we needed to put in place at the facility, they were activated as soon as the information came through. Gina?
Just back on testing, you said that there was that symptomatic testing was still occurring, but there was no real clarity around asymptomatic testing. Is that right? Is that where the miscommunication is?
So in terms of the ability to have 100% across everybody, that the systems weren't in place for that. That one of the things that we know and we've identified to health, and we're looking at and we've looked at ways to bridge the kind of the system that to ensure that it can happen, is that of course our staff who are MIQs can't simply leave to go to community testing stations because we're asking them to do a job in the facilities, often at the time those stations are open. So we've been working with health to identify some of the barriers to higher uptake, that being one. Another actually is but the time of day that you do the testing, because obviously we run 24/7 operations at our MIQ facilities. It's not a 9 to 5 operation, so that we've been trying to time getting testing teams into the facilities to coincide with shift change so that you can get both sides of a shift.
A little bit confused as to why it's taken 2 months to do that when we were told on the 23rd of June that regular health check and asymptomatic testing of all border-facing workers would be happening as part of the government's testing strategy.
Yeah, and look, I think the Minister of Health and the Director General have canvassed the issues around testing.
Told us why it hasn't happened.
No, in terms of the rolling out of the testing regime, that is a matter for health, and I think that the Director General and the Minister answered a lot of questions on it when they stood here today.
With them. Had you raised those concerns with them, that your staff had been telling you that they weren't getting tested enough and they didn't respond? Or who didn't respond?
Oh, look, we have been working with the Ministry of Health. It's the reason why we had rolled out surveillance testing. We had seen a shift that from July we did see surveillance testing, which was new, coming into our facilities. So there could be greater access to testing.
Sir, you said that this man had been tested on Thursday, the maintenance worker, as part of new mandatory testing. Does that mean that he wouldn't have been tested had that cluster not occurred on Tuesday? Not have been found on Tuesday?
Look, that's a hypothetical. I don't have the detail around what what the existing that got overridden plans for getting more surveillance testing into that facility were.
Whenever we talk about testing, though, Dr. Bloomfield always says that before someone goes to work in the morning, their temperature is taken, they're asked about symptoms. This man had symptoms 2 days earlier, which, if I'm doing the math right, would have been the Tuesday when the cluster was found. What happened to him on that Tuesday morning?
So he had his health checks on both days, and that he passed those health checks in terms of the temperature bit, in terms of and Dr. Bloomfield outlined this, that he did have a cough, but that was put down to a pre-existing medical condition that he has. So that he wasn't picked up through that, but what we have checked and can confirm is that the health checks occurred on each day that they should have for this individual.
Would that be more rigorous, though? So if it was put to we now know that the man had COVID-19, and it wasn't a pre-existing condition. So if someone goes into a health check and has a symptom, should they not go to work in one of the country's few MIQ
So
facilities?
did you say we know it wasn't a pre-existing condition?
Now it was COVID-19.
No, but when he reported his symptoms, he attributed it to a pre-existing condition. I think the important thing is the temperature checks and some of the others. I mean, what we do know is this is an incredibly tricky virus, that we do have people all around the world who do test positive, who display a range of different symptoms. It shows why it is that we have to ensure that we're putting many measures and layered measures of security. Now, I can hear the bell starting to ring, so we'll take a couple more over here.
When you're talking about the 30 to 40% of people who are covered by this voluntary regime, the CEO of the New Zealand Health Group, which contracts those health check workers, the workers who are conducting these health checks, she said, and they have workers in all 18 managed isolation facilities, she said that 0 of her employees had been tested. So would that 30 to 40% cover the people who are contracted to the facilities, or just the full-time staff?
Look, I am assuming that it covers the contracted workers from the data we've seen, because there's a number of contracted staff across a range of professions, but we're happy to follow up and verify that for you.
Follow up on Justin's question. If he shows up to work on a Tuesday and he has cough, it's the day that a community cluster is broken out and has been confirmed. Surely you'd err on the side of caution and send him home.
Look, he passed his health check, is what we can tell you.
We have a new cluster. Surely common sense here is you should go home and you should be tested straight away.
Look, as we can say, he passed his health check in terms of the temperature, which is one of the important parts of that. He had his test on Thursday. That's all we can tell you at this point in time. Sorry?
Do the health checks need to be stricter, that if someone can go into a facility with a cough, even if they have a pre-existing condition?
Look, I mean, we've always said that managed isolation has to be a part of a process of continuous improvement. We do need to look at what further measures need to be put in place to pick up people who are displaying symptoms, even if they may be going through the routine health check and deemed okay. We do need to look at ways in which we can strengthen that, and we certainly will be doing that as a result of this.
So was there ever asymptomatic testing at MIQ?
There was surveillance testing of asymptomatic workers, yes, that started occurring in July.
So we went a month without it after
we can get that for you, but my understanding is that will be both symptomatic and surveillance testing. So we'll need to get that number to you and see if we can break that down a little bit.
Just to be clear, we went a month without it after you promised it.
So I can get you the dates around when that surveillance testing started, but they are questions to put to the Ministry of Health. Okay, thank you.
And now featuring Petal Search, your gateway to a million apps.